Hi, I'm back again, still on Otitis Media. Now, the final presentation on Otitis Media. Okay, the question is, are there any complications at all? Okay, let's go and find out. Okay, the complications are 1. Recurrent acute otitis media. Had it before, could have it again. Mastoiditis, affecting the bone of the skull, having trouble hearing well, the speech is delayed, the brain is inflamed, meningitis, abscess is formed in the brain, cerebral abscess, carotid artery is in trouble with thrombosis right now, that may ascend up and lead to stroke. So stroke could be found in kids as well as young adults who will have acute otitis media. Subdural impairment, lateral sinus thrombosis, all these are not too good. It can give headache and give all sorts of troubles to whoever will have them. Cavernous sinus thrombosis, this will cause a lot of morbidity and can even cause mortality. There will be headache with cavernous sinus thrombosis. The pain here will be around the eye region, orbital pain, drooling of eyelids, double vision, and oculomotor pulses. So it's a serious issue. Labyrinthitis is inflammation of the vestibular nerves, and that could lead to dizziness, nausea, hearing impairment, vertigo, and the likes. Cholecystoma, when there's repeated infection in the middle ear, behind the eardrum, the cyst or sac could be formed, leading to hearing impairment and balance, and affect the facial nerve, and that moves to cranial nerve 7, which is facial nerve palsy. Wrinkle the forehead, that side is affected. Close your eyes, let me open it. Smile for me, and all the lies, it will show clearly. Vestibular dysfunction, like I've told you, when we'll be talking about ear problems, we'll be talking about two major issues, hearing and balance. So, chronic suppurative otitis media, from acute otitis media now going to chronic otitis media because the insult is being repeated year in, year out, and now suppurative, and you need serious antibiotics here. Okay, gait imbalance, because I've told you both the cochlear and the semicircular canals are affected, so both hearing and balance are impaired. So, prevention, as we're all aware that prevention is cheaper than cure, and even most times there are no cure for so many things. Okay, so educate the parents on the diagnosis and the risk factors, particularly on the identified risk factors. In that case, in that particular case, is case by case issue. Like if there's anyone smoking in the family, that must stop around this child. And if there's overcrowding, can see social worker and see how the family status could be improved. there's any other associated problem that should be treated because of this, like adenoid hypertrophy that will need adenodectomy, or cleft palate that will need surgical repair, and of course feeding babies laying down, or the use of pacifiers, or not breastfeeding adequately, if that is still possible, because this child might be presenting at a particular age older than the one that could be breastfed. But if you advise right now, if the woman will have other kids in future, that may help her to breastfeed them longer if she has the stamina to do that. Okay, then the importance of immunization cannot be overemphasized, because pneumococcal and flu shots that so many kids have taken, we discovered that with that, the rate of acute otitis media has dropped. Okay, to those who need surgery and to those who have taken surgery and they are on tympanostomy tubes, adequately advised. Correct, identify anatomical anomalies. Tonsillectomy for those who are having recurrent tonsillitis. Adenodectomy for those who have adenoid hypertrophy. If it is otitis media with effusion and without inflammation, it means there is fluid, but there is no inflammation. Could be secondary to acute otitis media, could present with tinnitus, conductive hearing loss. There may be fever, and if there is, it's going to be low grade. The pneumatic otoscopy will show immobility, and the treatment here is none. It resolves on its own within 3 months in 90% of cases. The surgery here is laryngectomy with ventilation and tubes and adenodectomy. The complications in otitis media with effusion are just like we've gone over when we were talking about complications in acute otitis media. So just brush over everything. It's just like that here as well. But in addition to that, there could be learning problems. And there could be atelectasis. Don't be afraid, I'm not talking about lung collapse here. I'm talking about collapse of the tympanic membrane. And we all know what that will mean. Okay, this is the last of the 3 presentations on acute otitis media. If I learn anything new, I will not hesitate to update here. Wishing all the affected kids well. Thank you for listening to my presentations. Please kindly subscribe to my channel so that you can be getting these presentations as soon as they're published. Thank you.